Hi there, my name is Teylър Симет. I'm an osteopathic physician from Baltimore, Maryland, and we're going to talk about joint cracking. I've been studying joint cracking for over 15 years, x-raying people, observing people, and seeing what the effect is when people crack or don't crack their joints. I tell my patients to crack their joints or not to crack their joints. I think having the noise is not what's important. It's having the use of the joints that's important. People who crack their joints tend to get less osteoarthritis. So I think it does have some protective benefit when you use your joints, even if using it means that they're going to crack and pop. The cracking noise is usually when gas is pulled past the fluid of this novium of the joint. And when you have the gas being pulled into the fluid, you get a pop as soon as you break the surface of the fluid. For more information on joint cracking and popping, go to the Journal of the American Osteopathic Association and search joint cracking.